All right, well, good morning, everyone. Thank you for joining and attending the Adherium Limited webinar. My name is Luke Allaire. I'm the Director of Strategy and Sales Operations here at Adherium, and I'm pleased to host today's session. Kevin Gessner, the Non-Executive Director, is going to provide an update from the company at a truly exciting stage of its clinical and commercial development. Afterwards, we'll host a short Q&A session, and you're welcome to submit any questions via the written Q&A section at the bottom of your screen, and we will queue those up and get to as many as possible. So, Kevin, go ahead and
Hey, well, thank you everybody for joining us today. Like Lou said, good morning, good afternoon, and good evening to some as we have people joining us from Australia and North America as well, where it's evening time. So, as Luke said, my name is Kevin Gessner. I am a non-executive director with the company. I joined the board in the first quarter of this year. I have been involved with the company for a few years now in an advisory capacity as well, where I helped introduce the company to some of the key contracts that are in place now, which I'll be giving an update on, specifically with Allergy Partners. Also introduced the company to Intermountain Health a few years ago, and I will talk about how that program is going. Some very exciting um, updates there in terms of how that onboarding process is going, but also some of the potential results coming out of that program. Thank you again for joining the investor update. Okay. Like Luke said, feel free to type questions into the chat throughout the presentation, and we'll get to them at the end. So, real quick disclaimer. I'm going to start with a brief company overview. So a little bit about Adherium in the marketplace. So as we all know, the asthma and COPD markets, unfortunately, for patients is huge. But for the company, represents a huge unmet medical need. In the United States alone, there's 40 million patients with COPD diagnosed COPD and asthma. Adherium has developed um, groundbreaking leading technology to help patients monitor their medication utilization, their medication technique, but also physiological parameters such as inspiratory flow that can help us better understand if a patient is doing well, taking their medication, taking it correctly, and if they start to deteriorate. So it can also act as an early warning system for patients. In addition to having the great technology, like I referenced earlier, we've secured contracts with some of the largest and leading organizations in the United States that have now given us access to start onboarding up to 1 million patients. I will talk about the scale of some of these organizations and that represent the opportunity for us to get them on this technology to help Adherium improve the lives of these patients. So that's the stage we're at now, is in that commercial scaling phase in the United States, heavy focus here in the US. Once we build scale, obviously there'll be huge amounts of opportunities for data monetization. Our devices collect a massive amount of information about how a patient is doing, which can be utilized in many different ways in the future once we achieve scale. And exciting potential to use that data to actually predict exacerbations and asthma attacks and hospitalizations in the future. There's been some great work done there to show that the data collected from the Adherium devices, the Haley devices, can actually predict exacerbations before they happen. And if we can predict them, then we can engage the patient with physicians and with our staff to help prevent those hospitalizations and exacerbations. And that's of tremendous value to the patient, but also tremendous value to their physician and to US governmental and private payers. Okay. So a little bit about COPD. Obviously, globally, a huge unmet medical need. 384 million patients globally, 3.5 million deaths, 5% of all global deaths. Still in the top four for global deaths, and in the US as well. The vast majority of patients using asthma inhalers and inhalers for COPD do not utilize their inhalers correctly. So there's so many different types of inhalers, and they are complex. There's dry powder inhalers and DPI inhalers and PMDI inhalers. And in addition to the multiple different types of inhalers, there's just a lot of complexity as they often switch from one medication to another. This is an opportunity for Adherium because this is a direct challenge that we can help improve for the patients. And if they're not using their inhalers correctly, they do not get the medication where it needs to go, which is into their lungs. Often patients will utilize inhalers so incorrectly that most of the medication winds up in their mouth or their throat. And if that's where it ends up, it's not going to help them. Uh, and most of the hospitalizations, especially in asthma, but also in COPD, are absolutely preventable. The problem is nobody knows who's getting in trouble until Adherium and Haley. So with the Haley Adherium system, we can start to pick up data signals that tell us that a patient is starting to get deteriorate as well. And as I said earlier, if we can tell that they're starting to have difficulty, we can help them avoid those exacerbations and hospitalizations. And with that, obviously, when we prevent exacerbations and hospitalizations, we can help avoid some of the massive costs associated with COPD and asthma, which is over $100 billion annually in the United States. So just a couple points I want to highlight here. You can see not almost a million asthma ER visits a year, 1.5 million COPD visits a year, 95,000 asthma-related hospitalizations, and nearly 750,000 COPD hospitalizations. And specifically, COPD hospitalizations are extremely costly to the U.S. payers. They're traumatic for the patients, but you can imagine many COPD patients have multiple comorbidities. They could have five, six comorbidities. So when they wind up in the hospital, they do wind up with long hospital stays, and that they often get a significant number of tests and other associated medical care while they're there. So very costly when a COPD patient winds up in the hospital. So one of the major goals for U.S. physicians, hospital systems, and payers is to keep those COPD patients well controlled at home, which is exactly where we come into play. So, as I've been talking about, Haley is a really powerful co-pilot or partner in making sure that patients stay compliant, and it's a preventative or proactive care measure. And here's some of the information that shows the results of using the Haley system. We know that when patients utilize our Haley systems, that they're more adherent. Adults are more adherent, children are more adherent. It reduces exacerbations, reduces hospitalizations, a lot of peer-reviewed studies, and certainly a lot of patients have used these in clinical settings in the past. At this point now, we are purely focused on bringing these great results that have been demonstrated in clinical studies to patients in the real world in clinical care. So I'm going to really quickly talk about the three channels that we're focused on here at Adherium in the United States and some of the partners. So I think from past presentations, you may have seen that we had secured an agreement with Allergy Partners, which is the largest U.S. Allergy group medical practice in the country. They have 300,000 asthma patients. We are now onboarding patients at their at multiple locations. They're across 20 states in the United States. And we are going from practice to practice, training the physicians, and then deploying our services to onboard the patients. The major change over the last year with Allergy Partners that has occurred is Adherium is now taking on the responsibility to do all the onboarding activities. In the past, Allergy Partners had attempted to do it themselves, but this is not what they do as a core part of their business. So when we renegotiated the contract with them last year, we all agreed that it would be best if we actually onboard the patients, and that model is actually working much more effectively. We are bringing on teams to do the outbound calling. but also utilizing text messages to recruit patients on and getting their physicians to refer patients into us. And that's one of the major uses of funds that we'll be asking for is to bring on the onboarding teams as we got a huge backlog of patients. So we currently have 50,000 patients from Allergy Partners that we could reach out to, literally this month, but we need to have the teams in place to make sure that we can onboard them properly. We also have Centa, which is the third largest allergy group in the United States, with over 100,000 patients. And earlier this year, we signed CIC, which is the largest U.S. group allergy purchasing organization that has providers across 33 states with over 50,000 patients. So that's an agreement that we got this year. So just in the allergy practices alone, 450,000 patients. We think the other large U.S. medical practice groups will also sign with us sometime this year. So really great momentum getting the contracts in place. And now, like I said, it's getting the onboarding patients in to address this huge backlog of patients that we now have to onboard to our system. A quick update on U.S. health systems and payers. So, as some of you may have heard in the past, if you've attended updates from Adherium, we had an agreement with Intermountain Health. It's going extremely well. They're a large, very innovative hospital system that is also a payer. So they have a payer called Select Health, and they are a provider through the health system. 33 hospitals, 385 clinics throughout Utah, Idaho, Colorado, Nevada, and Kansas and Montana. They have about 250,000 respiratory patients in their care, and they are currently offering the Adherium solution in all their pulmonary clinics across their five major hospital systems in the Utah area and their pulmonary care clinics. So we have a quick update there. Over 800 patients now on board with Intermountain. And the another great thing about Intermountain is we're able to get a lot of information about how the program is working because they are a fully integrated payer provider. They will be publishing information on the results of the program that they're currently running. The program now has been up and running for over a year. They are still targeting 2,000 patients on. They're almost halfway there. But this is going to give us a lot of opportunity for robust data in terms of how patients are improving their asthma, improving their COPD, and we'll be able to get reduction in hospitalization data sometime in Q3 and Q4. We also have two updates. Endeavor Health and Cleveland Clinic are planning which are two large hospital systems, one in the Chicago, Illinois area, and the other one in Cleveland, Ohio. Both health systems are planning to start pilot programs. We're not going to be looking at huge numbers of patients on with these two systems, as most health systems want to dip their toes in before they go big. But the fact that we have our next two health systems putting on patients in Q3 and Q4, and these are also both really reputable large health systems in the United States. So it's a great sign that some additional health systems now are seeing the value and the potential in the Adherium Haley solutions and starting to put some patients on and to build the capability to hopefully scale in the next year or so. As far as U.S. payer and value-based healthcare programs, which is the third channel. So AMC and VRI are organizations that have contracts with regional U.S. payers to do remote patient monitoring. They have asked us to be their respiratory care solution and provide our Haley products to them. And we'll talk a little more about them. But the great news is AMC's contract was signed this year. They've put on 300 plus patients already. VRI was also recently signed, and they have over 100 patients on in the first few months as well. So some really positive partnerships there that are immediately starting to put patients on post-signature. Okay, so a little bit about how the revenue models work. So in the medical groups with Allergy Partners sent to CIC, we onboard the patients, we do the monitoring, we then provide that information to the care providers who do the billing of the health insurance. The Allergy Partners physicians will collect anywhere between $100 and $160 per patient per month. From that, we get paid based on the contract, $50 to $75, depending on the contract. Specifically, with Allergy Partners, we get $50 to $55 per patient per month. So over $600 per patient per month. Now, it has about a 30% growth margin. We're anticipating we will get 3 to 5,000 patients on by end of year. Again, the biggest thing that will depend on how many patients we get is how many onboarding teams can we put in place post this equity raise. We'd like to get a number of folks hired to really accelerate and address the huge backlog of patients. Like I said, at Allergy Partners alone, if we had the resources, we could reach out to 50,000 patients. And I'll tell you about how the percentages we seem to be getting on in the early programs with our current onboarding teams. As far as the health systems, what we'll be looking to do with those initially, Intermountain Health purchased 4,000 devices from us. Endeavor and Remedy will also purchase devices. But the really big opportunity for that would be to renegotiate those into value-based care programs in the future. Like we said, Intermountain is also a payer. So as the results of the project continue to come to fruition, we'll be able to negotiate the ongoing per member per month fee. Like I said earlier, Intermountain is targeting 2,000 patients just at Intermountain. They're already at 800, so we should far exceed the 1,000 patients. But we have a range of 1 to 2,000 patients from the health systems. And like we said, Endeavor and Cleveland Clinic are just getting started, so don't want to put a number based on the fact that they're just getting started and we have to get all the integrations done. The last segment here of the value-based payers, the way this works is the value-based payers like AMC will sign contracts with like Blue Cross and Blue Shield plans in Minnesota, for Michigan, for example. They collect anywhere between $80 and $130, and then they pay us for the respiratory patients $30 to $35 per patient per month. Great news there is we don't do the monitoring. AMC does the monitoring. AMC does the onboarding. So our gross margins are really high in this segment at about 60%. So a quick breakdown in terms of potential ranges that we could see in terms of scaling in calendar year 2025. We're anticipating somewhere around 6,500 patients with about $360 per patient for the value-based care and with a 60% margin. And then the RPM patients, we get about $660 per patient per year with about a 30% margin. In calendar year 26, based on our current backlogs, we think we can achieve somewhere around 3 times that, and then again grow that into the 80,000 range in 27. Based on these numbers, we would achieve break even sometime in second half 2026 as a company. So the faster we can onboard patients, obviously, the quicker we can get there. Okay, so I'm going to talk a little bit about how we onboard patients. Want to give you some specifics and details of how we work with Allergy Partners Center and CRC. So we've developed a repeatable playbook on how to get patients on. We actually will invite patients. So we have access to all the providers' electronic medical record systems, so we can go into their healthcare records and literally pull list of 40. I've referenced 45,000 patients. We've already pulled list of 45,000 asthmatic patients that have compatible inhalers with our devices. We will invite these patients via text messages, but also through a call center. And with the text message program, we're seeing 4 to 5% success rates, and we're about to kick off the call center. So we're anticipating a 5 to 7.5% conversion rate via the text message campaigns and the outbound call center. The other way that we get patients onboarded is, quite frankly, the physician refers them to us through their electronic medical record. So when they're seeing a patient in their office, they simply have to go into the electronic medical record, click on RPM, and then they click on asthma remote patient monitoring and they enroll the patient. We then get a notification that the physician has referred a patient to us. And we see really high conversion rates in this segment because the physician has already talked to the patient about the program and told them why they think it's important for them to participate. So we are generally seeing 30 to 40% conversion rates when we get a referral in from a physician, which is obviously a really high success rate for remote patient monitoring. So part of our kickoff with every practice is we meet the physicians, we make sure they understand the program. We then give them some counseling and thoughts on how to do a referral. We show them how to use the EMR referral system. And then we build them in from trialists to advocates. So the entire year, this year and next year, we will be building uh, up a number of physicians that are becoming common and frequent referrers to us. Okay. So how would that translate into patients? So like I've talked about, let's just think about the medical groups alone. We have 300,000 patients already under contracts, 5 to 7.5% conversion rates, the speed of which will be dictated by bringing on those teams. With those conversion rates, we would get 15 to 22,000 patients just from the text messages and outbound call center programs, just with the medical groups alone. As they refer patients to us, if each physician, there's 120 physicians already agreed this year to start the program. If each physician were to simply refer one patient per day, so 20 patients per month, 2,400 referrals, at a 35% conversion rate, we'd see an additional 5,000 activations from physician referrals. So that's just how we break down the patient funnel to give everyone an idea of what we're expecting in terms of the number of patients onboarded this year and next year through the medical groups. Okay, we're going to flip back over to the hospital systems and Intermountain Health and Endeavor and Cleveland Clinic. And really, this is a game changer for patients in Adherium. Like I said, over 800 patients targeting 2,000. Intermountain has absolutely told us over and over again that they believe this is now the standard of care for the way respiratory patients should be monitored. Really, what they're doing is they're utilizing this system in a way that is referred to as in-between care. So, a physician sees a patient in a hospital and then they get discharged. They may not see that patient again for 3 months. The remote patient monitoring Haley system allows them now to have insight into what's going on with that patient between that hospitalization and that next visit that may be 1, 3, or 6 months away. So that in between time, this patient is getting constant monitoring of their respiratory condition, their medication utilization, their albuterol utilization, which is for rescue use if they're starting to have wheezing, and also their ability to inhale. So our sensors have inspiratory flow sensors that tell us whether they have enough inspiratory capability to breathe the medication deeply into their lungs. And if you remember early in the presentation, I talked about if you can't get the medication into your lungs, it's not going to help you. So when patients start to have deteriorating inspiratory capability, it also can be an indication that the patient's getting sick. And at that point, a care provider will receive an alert, and then they can reach out to the patient and help them and hopefully keep them controlled at home versus winding up in the hospital. And that's really what we're hearing from the clinical folks at Intermountain, that's working just as we described it. They're looking to publish some of the results of the work they're doing in Q3 and Q4 of this year. They have told us the early signs are extremely promising. They've given us lots of anecdotal stories about patients that had been hospitalized or in the ER 3, 4, 5 times before joining the program that have not been in the hospital or ER since. So really exciting opportunity and really exciting data coming potentially from Intermountain showing that the system works. They're also telling us that the net promoter scores are extremely high, so patients love the program. and very, very little negatives on those. But we don't have the data yet on the exact Net Promoter Score, but I'm told it's remarkably high. AstraZeneca is also looking to integrate our two new inhalers. So they're looking to integrate their Breztri and AirSupra into the program. So we're currently in discussions with Intermountain and AstraZeneca about adding our new commercial devices to the Intermountain program so that more patients can be eligible for the Intermountain program. A last bullet point here is this program is starting to draw interest. Like I said, Intermountain is highly reputable, and what Intermountain does, people take interest in. So we have received interest from some large U.S. national payers. I actually met with one a week and a half ago, along with Jeremy, the interim CEO, and they are looking for a respiratory care solution. So that's a really exciting opportunity. They want to hear about Intermountain's results. So that's really the next step there is as the results come out, we will have Intermountain and Cigna get together along with us. This is a huge opportunity for the company. They have probably 1.2 million COPD patients and about 2 million asthma patients. They care for about 18 million medical lives. They are also, Cigna also owns Evernorth, which has access to over 100 million lives. So really a game changer of an opportunity that we're just exploring with a large U.S. national payer, which is a phenomenal sign of momentum. Okay, I'm not going to go much deeper into Endeavor and Cleveland Clinic, except to say that we're looking to get these programs and patients started in the next few quarters. So again, through our value-based programs through AMC and Tanovi, about 400 patients currently onboarded in the early implementation days. We're tracking to 1 to 2,000 for this year. I don't put a lot of specifics on these numbers. We don't control the onboarding, but the fact that AMC has now put in 5 orders is a really encouraging sign. So I think I've said this before to others that, I don't get too excited when they place their first order, but when they place their second, third, fourth, and fifth, then some excitement starts to build because people don't reorder devices unless they're putting them on patient and getting them out to patients. So they've now purchased over 1,000 inhalers, and like I said, have 300 on. Most of the patients will get 2 inhalers, so that means they've bought their next group of inhalers to onboard more patients. So very exciting. Like I said, the patients that are utilizing these are from a Blue Cross and Blue Shield payer plan in the U.S., which is another good sign that a U.S. payer has expressed the need for controlling their respiratory patients using the Haley system. And VRA, again, another early program, but 100 patients put on in the first 3 months of adoption, and we'll be continuing to work with them to try and accelerate the number of patients on through VRI and Tanovi. So I just want to provide a couple of quotes from Kim Benyon. We do have videos, and also Dr. Bill McCann at Allergy Partners. I'm not going to show the videos, but this is an example I think I referenced earlier. Kim sent us a story of a patient with 5 emergency department visits and a hospitalization admission in 2023, had a terrible ACT, and it was one of the first patients they put on the Adherium system at Intermountain. And since then, their ACT score has dramatically improved, and they have not had a single ED or hospitalization in 2024 and going into 2025. So just an amazing result from someone that was having massive issues with their asthma that was resulting in frequent visits to the hospital and emergency department, that now has learned how to control their asthma at home. This translates into not only great patient care, but physician satisfaction, but also dollars saved by their health plan, which is significant for them as well. And with Allergy Partners, Dr. Bill McCann is a huge advocate, and he's really referring to what I talked about earlier about the in-between care. It was so frustrating to so many physicians that they see these patients and then they have to, they see them for 5, 10 minutes in an office and then they don't see them again for months. And they just sit there wondering if the patient's doing well. And they really don't know. And often these patients, the next time they'll see them will be in a emergency visit. So to have the Haley system on board with their patients gives them that comfort that the patients are being looked at in between the office visits, and that if anything's going on, that our monitoring teams will reach out to Bill and his colleagues to help the patient get under control before any type of hospitalization or emergency department event. So I'm just going to leave on a snapshot of the system so you can see we have currently 15 FDA and TGA cleared smart inhalers. It's extremely broad portfolio that covers the vast majority of patients. We pretty much cover all moderate and severe COPD patients, which is 100% of the market because we have the Elliptas and the Breztri and Brio devices from AstraZeneca. So phenomenal coverage both in asthma and COPD. All that data is pulled into our cloud, and then we have a population health EMR dashboard where we do the monitoring. Obviously, the patient uses a patient app still, but what we also now have in place is respiratory care teams at Adherium that are monitoring the data, and they're the ones that will help the patient. And if there's signs that the patient's starting to get in trouble, we'll reach out to their physician and help get them the care they need and keep them out of the hospital. The future opportunities are really amazing. You can imagine the amount of data we're pulling in from these devices, the fact that the data can be used to predict hospitalizations in the future, will really open up a huge number of opportunities for us to develop predictive algorithms, AI-driven support tools, software as a medical device in the future. But our main focus is getting the patients on today, starting that monitoring process, and we'll be collecting all that data and analyzing it and building out those algorithms over time. So, real quick in summary, like I said, what we're focused on now is getting those onboarding teams in place and then scaling in the US, the RPM solutions to get those patients on board. And that'll lead to everything in the next three columns in terms of the predictive capabilities, product expansions. And we also are doing demonstration programs in Australia. Obviously, asthma is a huge problem in Australia. And we're designing these demonstration programs to again take the great successes we're seeing at Intermountain and at Allergy Partners and demonstrate those in the Australian environment with the hopes of the Australian government starting to support and pay for remote patient monitoring services in the future, which will not only improve the patient's lives, but also save the Australian government money. So that's our focus in Australia at this time. But the vast majority of the commercial efforts are all in the United States. So just a real quick snapshot of the team. I do want to highlight a couple changes. We did bring in a really seasoned individual that has done remote patient monitoring onboarding in the past, Jason Hockman. We also have an experienced head of product that we brought in, David Haddad, to recruit some additional really talented folks to the leadership team. Obviously, Luke is on the call today. John is still in our business development function, and Jeremy is currently in the acting CEO role. Okay. Just in case I always get this question about patents, we have tons of patents out there, over 180 patents and designs globally. But not only do the patents protect us, there really are no competitive solutions out there to us in the United States. Happy to take questions on that, but our solution in respiratory is really the most robust because we have the broad number of devices that cover the vast majority of the market. Nobody else has that kind of coverage in the marketplace. Some of the other companies that did have or do have some smart devices don't have that type of breadth of coverage. They also often don't have the intelligent sensors. What I call some of those products are dumb sensors because they basically just tell you whether you push the button or took the medication, but they don't actually have all the additional sensors for inspiratory flow built in. So they're not the smartest devices. Where really Adherium is the only one that has that breadth of truly smart inhalers. The other thing is getting the contracts with some of these largest organizations is also a unique and hard to replicate challenge for other companies. As you get embedded with a large organization, you get your workflows down, that becomes a barrier for others to overcome as well. So we have really good protection in terms of patents, but also in terms of our go-to-market approach. So I'm going to pause there and say thank you. And then Luke, I don't know if you want to take a look at some of the questions and see what I can answer in the chat.
Yep, exactly. And if anyone else has additional, we have a few questions we can get started on. If anyone else has more questions, you can use the Q&A icon down at the bottom of the screen. So the first question, you kind of started to touch on it, but can you talk about the competitive landscape and how you see it developing?
Yeah, so really great conversation. I'm going to use my conversation with Cigna Health a couple weeks ago. They currently have an agreement with a company called Omada Health that actually in the United States just recently went public. Omada they provide remote patient monitoring services to Cigna, which is the eighth largest U.S. medical health insurer in the United States. And they provide those services for diabetes, congestive heart failure, and weight loss. They just recently went public in the United States, Omada did, but they don't have a respiratory solution. So when Cigna was out there looking for, okay, what about our COPD patients? They're high cost. We would love a solution similar to, the services that Omada is providing in respiratory. And I was meeting with one of the vice presidents, with Jeremy. He said there's nothing else really out there that with the robustness of Adherium. Your devices, cover the vast majority of our COPD population because they cover all the double and triple medications. And now they're just, looking forward to seeing the results of Intermountain. Really, when I look at that kind of conversation, and you have a large U.S. national payer looking for a solution, and they don't see much out there, but they see Adherium, that kind of tells me a lot about the current environment. So, as some of you may know, another company that had smart inhalers, Propeller, um, left the market. They'd been purchased by ResMed, but they're no longer in the market. And when I discussed with the folks from Cigna their views on Propeller, because they did give Propeller a trial, Propeller, always tried to circumvent the physicians. They did not work with the HCPs like we do. They also did not invest in the HCP onboarding processes like we are. I'm sorry, the patient onboarding processes. So when they gave them a list of patients that they wanted monitored by Propeller at the time, they never could get patients on. He said they'd give them 50,000 patients at a time, and they would see, single digit number of patients getting on the program. So that's why they ultimately, did not continue with that program. And what we're demonstrating is that 5 to 7.5% onboarding. If they hand us a list of hundreds of thousands of patients, it's easy for us to then translate what we can get on. So if we can't get patients on for them, then they won't save money. So a lot of our conversation was about our onboarding teams and our onboarding processes, which are showing, like I said, that 5 to 7.5% onboarding success. But there really are no other solutions for them to look at that have the ability to scale like we can. So hopefully that answers your question.
Yeah, and one thing I just wanted to add in there, Kevin, is as far as the remote monitoring component, specifically to reimbursement in the United States, because for remote physiologic, remote therapeutic monitoring, a patient can only use one device or one solution, whether it's for cardiac or respiratory. And on the respiratory side, there's a pulse ox, a spirometer that the patient would blow into, and then there's the adherence with the medication. and the adherence with the medication is the threshold to reach these reimbursement levels is so much lower than you're asking patients to do something outside of their normal behavior, like blow into a device, or try to take their pulse ox on a routine basis.
Yeah, yeah, great example too. And just a little extra color. Allergy Partners had gotten many pitches from remote spirometer companies trying to do remote monitoring with spirometers, and Bill McCann flat out said, "Look, it just makes no sense to make someone do a spirometer every day." But monitoring them to utilize their maintenance and medication every day absolutely is clinically relevant. It's what they're supposed to be doing. It doesn't change their behaviors. So he would never entertain a contract with those companies that tried to pitch him on that. But when I brought the with the team the concept of monitoring the maintenance medications and rescue medications, as Bill said, it's a no-brainer. So we just got to get the patients on, and we have access to all their patients now.
So the next question, you talk about a patient backlog. What is the key factor the company needs to address to bring this backlog to commercialization?
Yeah, so we're currently a great question. So we're currently preparing to staff up. We've interviewed 10, 12 different folks to start doing outbound calls. We have a call center being set up. So really that's the big opportunity there. So we currently are running text messaging campaigns, and then we have people reach out to the patients to do an onboarding call, because when we find we do a Zoom or a Teams onboarding call, that we get them on and we keep them on much longer because we explain the benefits to that patient. So we need those teams to basically do the outbound calls and also to handle the referrals that come in. So we are currently hiring 5 to 10 people to do the call center, and that's what we're going to utilize the resources from this equity raise to support. Um, that is clearly the number one thing we need. We just simply need the people in seats to onboard the patients, and then the second thing is our head of product is making enhancements to the system. So to make sure once we get them on, that we keep them on at a really high rate. Again, from the Intermountain example, we're seeing incredibly high net promoter scores. I'm told in excess of 80% net promoter scores, which is superb. The reason that's such an important thing is, we work hard to get the patient on, and if we can keep them on, and certainly a net promoter score that high will keep them on, then we can achieve scale.
Similar to this, you may have touched on this, but how will the organization cope with its expanded role in the process, specifically the onboarding process, and what is involved in the onboarding?
Yes, I touched on a little bit. So the initial onboarding process is literally a Zoom or a Teams call, where we explain the benefits to the patient. We explain to them their insurance coverage. We make sure they're comfortable. We explain to them why we're monitoring. We have to build trust with the patient. So that initial onboarding call, which takes anywhere from 10 to 15 minutes, is really critical. And then the second team we need are the people to monitor the data. Now, the system monitors the data for alerts, and then we have to have some people to manage any alerts that come through. So, for example, if someone took 15 puffs of their albuterol, we want someone to take action on that. So we have respiratory therapists that will get alerts, and then they will reach out to the patient to understand what's going on, and if necessary, refer that patient into the physician to get care. In the Intermountain environment, we don't do the active monitoring. The clinical nurse educators in Intermountain actually do the monitoring. So in that hospital setting, they've elected to have their own staff do the monitoring, which has worked out really well, and we don't have to bear that cost in the Intermountain example.
And one other thing I would just add to that is a lot of these patients are not educated on their disease, specifically for asthma. Sometimes they don't know the difference between their maintenance and their rescue. So this onboarding piece is so critical to the patient journey to ensure that they understand their disease better, get them more engaged with the data that we're collecting and showing them as part of managing their disease better. And that's how the retention rates continue to improve. Next question would be, how many other respiratory monitoring companies have access to the EMRs at these medical clinics?
Yeah, so at Allergy Partners, none. and Centa none. I do believe they were using remote spirometers at one point. They may have some patients still on it, but that organization recently was sold and is, I believe, no longer onboarding patients within Centa. What happened with that? What Centa found and what they told us is that they would get patients on, but patients didn't want to use a spirometer 16, 17 times a month. And if you don't use the device at least 16 times, then you can't collect the fees. So Centa wouldn't get paid, and then Centa couldn't pay the partner if you're not hitting the billing criteria. What's different with us is you're supposed to use your maintenance inhaler every day. So, if there's 31 days in a month, you should have 31 data readings. And we monitor their utilization of their maintenance inhaler. So if they don't use it, we'll reach out to them via a nudge or a text message to get them back on board with their maintenance inhaler. And we're also monitoring the rescue as well. So, uh, that was the only one that I knew. Allergy Partners had turned all the other remote monitoring companies down. Everybody pitched them because they're the largest in the United States, but they chose Adherium. Centa, again, they tried the uh, spirometry. They did see positive revenue, but they see a lot more potential in the Adherium solution because we can hit that full suite of codes because the patients will utilize the 16 data points.
Another one is what is the skill set of the people you need to hire? How available are they, and how long does it take to onboard them and get them servicing patients?
Great question. We're actually been doing it all the month of June. So we put a number of people into the interview process about 3, 4 weeks ago. We actually just finalized the interviews, and we are getting ready to send out offers. We will train them. It'll take a couple days to train them. We've already done mock as part of the interview process. We have them do mock phone calls, and we're about to put offers out. So about a month to on board to recruit the folks, a week or two to train them. And obviously, once we start deploying them out into the field, we'll monitor them just like, we'll do recorded calls. We'll have people listen in and make sure that they're doing a really effective job. And also, what we do is we've set up their compensation structure that they basically get paid a bonus for every patient that they activate and enroll. So they're highly financially incentivized to enroll patients. Uh, so every patient they get in, they'll get, $15 or $20 per patient that they enroll. So a really nice incentive opportunity for them to enroll a patient.
Based on your expected customer mix at scale up, what is the cash flow break-even revenue?
Yeah, so like we said, based on the numbers we put in the slide earlier, w if we get to those numbers, we should be in break even in second half of next year. I did not put those in there to do financial projections, but we believe they're extremely obtainable. We have a huge backlog of patients, so our goal is to just onboard as rapidly as possible and achieve that and exceed the break-even point as fast as possible.
There's information or data regarding customer retention after onboarding, and there's also a question on the churn of current patients.
Yeah, so retention, it's a super question. Retention is critical. Like I talked about with the spirometries, that was a real problem for them. They were seeing retention in the high 60s. That's not good enough. We need to see retention in the in the low to high 80s. That is what we're seeing in Intermountain. We're seeing retention over 90% at Intermountain. That's a really strong program. Currently with our allergy partners programs are early days, but the vast majority of patients that we've put on are staying on. And part of the reason we're able to keep them on is because we are actively monitoring them as well. So they really do feel that support. But yes, it's a critical KPI for us. And we are forecasting that we'll be able to keep the retention above 80%. Obviously, the better we do there, the better we will do overall. Every point in retention matters. So if we can get it from 80 to 83, 83 to 85, that is a critical number that we will be monitoring on a weekly and monthly basis. but really good success in the early days, both with Intermountain as on small numbers, but really 800 patients, strong retention at Intermountain.
Yeah. And one thing I just wanted to add to that is the additional data that we collect on the technique, that really helps engage the patient, want to take their medication correctly, want to be involved, and they really enjoy the technology. And we're continuing to make those product improvements and enhancements to make that more easy to read, easy to view for the patient.
Yeah, and maybe one other thing I'll add too, if you think about how we've entered the market, we've entered the market in specialty, right? So allergists or specialists that are taking care of the more moderate to severe asthmatics. At Intermountain, we're going through their pulmonary care clinics. So these are the moderate to severe COPD and asthma patients coming through those clinics. So some of you know some folks with asthma. If they have very mild asthma, that's not really the patient we're targeting. We're targeting the patients coming through specialists. And these are the patients that will need to use their maintenance inhalers for the rest of their lives. If you have COPD and you're on a Trelegy, you're going to need to use that for the rest of your life, or you will not breathe properly. So, just in case any of you are thinking, "Hey, I know an asthmatic, and they use this puffer once every month," that is not the target patient we're going after. And because we're going into the specialty care clinics, they take care of the moderate and severe patients. So when I say we have a 300,000 patient backlog at these allergy practices, these are the patients that have already sought out specialty care for their asthma and COPD.
So we have a couple questions on the update of the hire of the new CEO, or how the CEO search is going, and what skill set are we looking for in that CEO?
Yeah, so we're really close. We have a finalist candidate, and we hope to make an announcement on that soon. The skill sets that we've been looking for, and myself in particular, is great leadership skills. Obviously, building a great team. The quality of the team matters. You saw we onboarded some new individuals that are just absolutely aces. I'm a big believer that the higher the quality team and great leadership, when you have a great product, those two things mixed together will make the magic happen. So really looking forward to having someone come on that will build a highly engaged team with a high sense of purpose and passion to help patients, but also get that onboarding done because that's the way we rapidly help as many patients as possible. But also that's the way we build the commercial value for the company.
What is the expected cash runway after this cap raise?
So we currently are utilizing around $1 million a month. Depending on how much we raise, that'll get us through the November-December timeframe. The goal here is to raise enough cash to demonstrate the onboarding, and then come back with the success we've demonstrated through the rest of this year. If we to get additional capital, if we raise more money, that'll just give us a little longer runway to build up a bigger bucket of patients to come back with. Obviously, if you come back, a year or so ago, we basically had almost no patients on, and now we have 1,500 patients on. If by January we're sitting at 7,000 patients and paying patients, obviously that's a huge change for the company from going effectively from no patients to thousands of patients with the potential with the backlog to go to tens of thousands of patients in 2026. We're looking for the runway to get us to that next demonstration point
Yeah.
of success.
So 2 minutes left. One more question in there. If anyone else wants to try to submit some more, try to get them in as quickly as you can. The last one, company has been trying to crack this nut for years. What do you think has changed recently that will provide you the confidence of the expected growth in onboarding?
Yeah, so a couple of things have changed. This is not easy. Onboarding patients is not easy. A lot of people have tried. I think one major change in the allergy practice is the company in the past put their fate of onboarding in partners' hands. So everything a year ago was kind of like the AMC VRI world, right? So they would sign contracts and hope someone else would put patients on, right? So we've done two things that are dramatically different. The company now holds its own fate. When we renegotiated these deals with all the allergy practices, we said we will dictate the pace of onboarding. Um, Allergy practices like, Senta and Allergy Partners, initially Allergy Partners said, oh, we'll put the patients on. That's not what they do. That's not their core business. Their core business is seeing patients in an office. So they came to the realization that this isn't what they do and it's not what they want to do. But this is what we can do. So we own our own fate in terms of to dictate the pace of onboarding with all the medical groups. We have access to the patient records. We also do the monitoring, so we make sure that the adequate level of monitoring is being done, and we make sure we put together the billing reports. A lot of what Luke does is compiles all the billing data for the practices to make sure that Allergy Partners is getting paid. And then we do monthly revenue reviews with Allergy Partners and Senta to say, hey, here's how many patients we monitored, here's how much you billed, and that they collected their money. So one of the things I should have brought up here is that we've seen almost 100% collection of the patients we're monitoring by Allergy Partners. So if it's Allergy Partners is getting paid, that means we're getting paid and the patients are getting better. So it's a win-win-win situation. So that's been a monstrous change. We hold our own fate in our hands and we dictate the pace of onboarding. Now with the partners, the major change we've done there is we do not sign deals with partners going forward unless they have demonstrated some ability to adequately put patients on RPM. So when we signed the deal with AMC, we had to feel confident that they'd immediately be able to put patients on. And that's what we saw with AMC that we didn't see out of previous partners. AMC put 300 patients on in the first few months, right? They've ordered 1,000 devices already. So we need to make sure, and the company now understands to make sure when we sign a partnership deal that it's the right deal and it's with an organization that has demonstrated capabilities to bring patients on board. We can't distract ourselves with organizations that are trying this for the first time. So that's another major change. I think the third change, and it really go back to the interest starting to get generated from U.S. national payers. That's the game changer, and the fact that they're reaching out to us asking about, hey, we need a respiratory solution for COPD. We don't see much out there. Can you tell us what you're up to? That is a huge opportunity for the company. One that we're going to have to be very smart. We want to get those 10,000 patients on through Allergy Partners and Intermountain. We want to make sure we have good onboarding processes because we don't want to bring on a large national US payer until we're ready to demonstrate success with them. And I think that's also the maturity of the company showing as well. Don't just sign a deal, sign the deal, sign the right deal, and sign it when we're ready. Quite frankly, that's what the payers want too. They don't want to sign a deal and then not see the patients come on. So they want to make sure we're all ready, and we're going to use the resources to get ready for these huge opportunities with payers in the future. Luke, any other questions, or was that?
That was it. So we want to thank everyone for taking the time to meet with us today. We
Yeah.
appreciate your support.
Yeah, thank you for your time and enjoy the rest of your day or your evening. And we really appreciate the time you spent with us on behalf of Luke and I and Adherium.